What's up, friends? Hope you're well. And in this video, I want to talk about an interesting niche in the home care, an interesting niche to get after in the home care business. So before I talk about this interesting niche, let me talk about where I've been for the last couple of weeks. Well, I'm back at my other base. I'm not in Atlanta anymore, but in the past couple of days, I'd say about eight days, I've been sick. And it wasn't life-threatening or anything, but it was an interesting kind of illness because I was bedridden for most of those 8 days. And in those 8 days, it got me thinking quite a lot. And what's interesting is that I haven't been this sick in years. It turned out it was just like a really bad flu, and I became so weak. I had a bad fever. I couldn't eat. I had a bad appetite. So this is a combination of things going on with me. I consider myself relatively healthy. What happened to me was very scary. I ended up going to the hospital to get checked out, and I was prescribed a couple of meds. The healthcare system here is amazing, by the way, in East Africa where I'm at. It's really good. It's comparable, really, actually, to, I would say it's comparable to Atlanta, probably better. The reason why I say probably better is because it's more affordable, to be very honest with you. In fact, majority of the time, they will try and discourage you from taking meds. So they will encourage you to change your diet. So that was strange to me. The point is, I went to the hospital and then I had to come back home because it wasn't an illness that required me to be admitted into the hospital. Fortunately, I'm around a family, and my family is great. My kids even were involved in helping me out when I was bedridden. I mean, simple things. Something as simple as somebody bringing me a cup of tea, a cup of juice, fresh juice in the morning. It really lifts your spirits, you know what I'm saying? So that had me thinking, how do people who don't have family, who are not as fortunate as I am, how do they handle being sick? Well, they don't handle it very well, unfortunately. Where we're seeing the decline of family in the West right now, especially in the United States, we're seeing a lot of people not starting families. So a lot of people are not getting married. Marriage is not easy by any chance. What happens to those people that don't have family? How do they cope? And I was thinking that's a very interesting niche that a lot of people in the home care business are not focusing on. That could be very interesting for you as a home care business owner, might consider approaching that niche, that demographic. The demographic is people who are not necessarily old, but they're young, relatively healthy like I am. I work out every day. And in those 8 days when I was sick, I couldn't work out. I was so weak. I couldn't even do my regular 2-3 miles every day that I do on the treadmill. Yet I still needed people around me to care for me. And I truly believe that in this new economy that we're shifting into, where people are not starting families, people are living alone, you might find that a lot of your friends right now, they do live by themselves. And you as the friend of those people, if they do get sick, would you have 6 to 12 hours to dedicate your time to take care of them? The answer is no. Realistically, it's not possible because things are so tough right now in the economy that we all have to work. So this leaves the caregivers that are available to take care of people that are sick, even though they're not old. In my case, if I was still in Atlanta, I would have loved to have somebody come to my apartment and take care of me, just like my family is taking care of me here in Africa. So what that means is that I would have loved to have somebody with good energy, somebody who knows how to activities of daily living. So simple things like, making sure I've eaten, making sure I've taken my meds, Because when you're sick, you forget, or you're so weak that you tend to forget because you're sleeping all day long, right? There was a time where I slept for 2 days straight. I couldn't figure out what time of day it was. Couldn't get a good track of time. So if I had somebody that was available to me in my apartment, making sure that they're monitoring when I'm taking my medication that's prescribed by my doctor, and making sure I've taken my meds, I would love that. And I know a lot of people who are my age that fall sick, that live alone. They don't have somebody like that to make sure they've taken their meds, to make sure they've taken their lunch or their dinner, and that sort of thing. Secondly, I realized that when you live by yourself, you're isolated. It's very easy for you to spiral. And this is how people get depressed. People who live alone tend to get depressed a lot. And fortunately, when I'm around family, I have different people to lift my spirits up, and we lift each other's spirits up. And a lot of people are not as fortunate as I am, like I said. And it takes a lot of hard work to be in this position that I'm in. It's not easy. And I know a lot of people don't have this. And it's a massive opportunity for people that are getting into this business to recognize that the economy is shifting, and there's going to be a massive need by not just the older demographic, because typically the older demographic is the one that needs caregivers. But we're seeing, by the very nature of how the economy is shifting, the demographics are shifting, people are living by themselves, not starting families. Regular people like me and you who fall sick are going to need these services, activities of daily living. So maybe it might not be somebody who's sick. Maybe somebody just got discharged from surgery from the hospital. That's an interesting niche. That person doesn't necessarily have to be old. There could be somebody who's relatively well off, that lives by themselves. And I know for sure I would have paid anything for that service if I was still in Atlanta. I don't know any home care agencies right now that are marketing to this demographic or people that are not old like me. I don't know any. It starts, I believe, by branding. There are a lot of agencies right now that claim that they can do the job, but what's really lacking in the industry right now is really branding to a specific demographic. So let us say you are wanting to appeal to this demographic of people that are not old like me. There are ways to capture their attention, and it requires a lot of branding. What that means is that not only are you focusing on social media posts or organic social, but you're also focusing on, TV ads or live sports. There's a lot of guys that are my age right now that are making a lot of money. Because remember, they're not starting families. All they're doing is working, playing video games, spending their money on betting on sports, on live sports. So there's big money in grabbing their attention where their attention is going. Let me explain what I mean by that. Things that bring convenience into their lives, because they get the money now, They spend their money on betting on live sports. So recently there's been a fight between Mike Tyson and I forgot the other young guy, but there's been a boxing fight. So if you're able to run your ads on TV or Netflix, wherever it was running ads on YouTube, wherever live sports are running, could be football, because we're in the football season now. So maybe you're running ads on live sports, and that's possible now because technology has come such a long way that you can actually run your ads in front of live sports now. Yes, you can, for relatively low rates. And I'm not talking about thousands of dollars, millions of dollars, because usually these ad slots, these 30-second ad slots, were dedicated to big ad spenders. Things have changed now, that you can actually get those ad slots for relatively low rates. You can run a TV ad for as low as $500. Yes, it's going to be in a very small geographic area. You can say, I only want to run my ads in one small city, rich neighborhood in my county, and you can dominate those ads just in your county or in your city. It's possible now with technology, and I know how to do that. So if you're interested in doing that for your home care agency, schedule time. Click the link below and I'll show you how. In fact, I'm actually going to do a dedicated video that will walk you through the platform called AdLib. Now, I don't use too much jargon here, but it's a DSP, demand side platform. It's a demand side platform just allows for you to place your ads on TV using one platform. There's so many opportunities now for you to grab people's attention as they're browsing the internet, as they're watching live sports, as they're playing their video games, so that when they do get sick and they do need your help, they will remember, oh, there's a home care agency that I've been seeing ads on that is in my neighborhood, that caters to my demographic. I'm going to give them a call. And they'll remember you. It's kind of like, if you remember back in the 90s, if you're as old as I am, back in the day, there used to be these local car dealerships that would run local ads. They'll run ads on local TV, and they'll run these ads so much on the local TV network or local news. They'll run these ads so much that you would always remember them. In fact, every time you drove past that car dealership, you would remember the jingle. The nature of marketing and branding is going back to that, to dominating your local area, to bring back those tactics that worked in the 90s for your home care agency. Starts first with scheduling a call. I'll talk to you soon.